It's a time of transformation at Kings County Hospital Behavioral Health Center in central Brooklyn. The new state-of-the-art facility features 300,000 square feet of modern space and an emergency room with more than twice the size of the one in the old facility. The new $153 million pavilion is a fitting backdrop to the real transformation. The Kings County Behavioral Health Center has dramatically redesigned its mental health programs and is actively promoting a culture of recovery-oriented, patient and family-centered care. There are new resources and additional staff with a deep commitment to bring about positive change, and the administration has provided the resources and support they need to deliver high-quality, comprehensive care to more than 12,000 patients per year in the central Brooklyn community.
I want to come to Kings County because if I come to Kings County, I know I'll get better. I will be treated for my illness. I will be treated with kindness, with utmost confidentiality and professionalism, and I will be treated as if the person who is treating me is treating a member of their family.
The path toward dramatic reform of psychiatric services at Kings County Hospital was initiated in January of 2008, when plans for staff expansion and new patient care models were being designed. However, the tragic death of a patient in the Comprehensive Psychiatric Emergency Program in the summer of 2008 was a catalyst for expediting these plans and motivated the administration and staff to implement widespread changes immediately.
The death of Esmond Green was a horrific tragedy that impacted all of us, her family, and certainly all of us here at Kings County Hospital. We all felt the pain of that tragic death.
As an organization, we vowed to confront this tragic failure on our part and to turn it into a learning opportunity, to ensure that nothing like it could ever happen again. Going forward, our aim is not just to provide an adequate standard of care for all of our patients, but to become an exemplary model for the delivery of the type of safe, efficient, compassionate, and patient-centered care that each of us would want for a family member with mental illness.
Providing care to people with mental illness and substance abuse conditions is complex and challenging not only in New York City, but also in communities across the country. The reforms at Kings County are responsive to these challenges.
Kings County has been, I think, at the forefront of a hospital wanting to really make that kind of change. I sat in a meeting at the very beginning of the process and they had all the administration there. And it was clear that everything was on the table. And I was always very impressed with that.
It's not about the four walls. It's about the care that's provided within those four walls. It's about the people, the dedicated staff of behavioral health services, and the patients we partner with.
The goal at Kings County is to address the comprehensive needs of the patient and support their psychological and physical well-being.
Since I've been coming to the continuing day treatment program, I understand and I learn a lot more about my illness. So I'm making strides every day, and I'm very grateful for the continuing day treatment program, all the things that we learn there. I'm looking forward to reacclimating myself to mainstream society.
The Kings County Hospital Comprehensive Psychiatric Emergency Program, or CPEP, offers mobile crisis teams, extended observation beds with added clinical support, and direct access to crisis beds outside the hospital setting. Patients who come to the CPEP are in need of all levels of care.
When individuals enter into our CPEP, they're immediately seen by a number of staff who start the triage process, which is begun immediately upon entry into the CPEP. Within minutes, there's a nursing assessment done. Within a half hour's time, they have a psychiatric evaluation. And from start to finish, individuals on average are out of the CPEP within 8 hours.
We admit the most acute psychotic patients in Brooklyn, and we triage these patients within 30 minutes.
At the core of the patient-centered design is a new team of peer counselors, full-time employees who have been mental health patients themselves and now serve as mentors to patients in the hospital.
I remember once telling a patient that I had schizophrenia, and they were shocked because they were under the impression that because you have schizophrenia, you can never work or live a normal life, and that's simply not true. And I was able to serve as a role model for this gentleman, and it inspired him.
Patient care does not end when patients leave the building. The involvement of family members and caregivers is an integral part of the new program design at Kings County and critical to the ongoing recovery for patients.
I'm not reluctant to pick up the phone and ask questions related to my niece and her care or her actions. I have no reluctance to that at all. I feel very good about the partnership.
The impressive modern facility is a very visible sign of the respect and dignity Kings County Hospital extends to its mental health patients. But more importantly, the behavioral health program staff understands that the building is simply the physical manifestation of a much more significant transformation throughout the entire organization.
We've had a lot of successes here at this hospital, but we can always do more. My vision and my philosophy is that every employee of this organization has value, that our highest organizational priority has to be respect for our patients and one another.
The real new beginning is to think differently about what we do every day and to not be stuck in the habits of an old system from an old building from an old time, but to really embrace the opportunities that we all have now in this wonderful building with a new staffing plan, with new policies and procedures, and with tremendous support. And I think that we're going to do the very best, and New York will be proud.